everyone, today I will be explaining the causes, symptoms, and example of four types of mutism, which is selective mutism, traumatic mutism, total mutism, and organic mutism. So, first I will discuss about the selective mutism. So the causes for selective mutism is mainly caused by severe social anxiety. So people with this condition often feel extremely nervous or fearful when they are expected to speak in certain social situations. There are also research which suggests that genetics may play a role, especially if there is a family history of anxiety disorder. In addition, environmental factors such as stressful, experience pressure from social situation, or change in routine can contribute to development of selective mutism. So the symptoms for selective mutism is that the most common symptom is the inability to speak in specific settings, even though the person is physically capable of speaking. They may communicate through gesture, facial expression, nodding, or writing instead of talking. So many individuals with selective mutism appear shy, withdrawn, or uncomfortable in social situations. They may also avoid eye contact and have difficulty participating in classroom discussion or social activities. Moving on to the next mutism, which is traumatic mutism. So the causes for traumatic mutism it occurs after a person experiences a highly stressful or traumatic event. This may include witnessing a serious accident, experiencing abuse, being involved in a natural disaster, or losing a loved one. The emotional shock from these events can be overwhelming that the person temporarily loses the ability or willingness to speak. So the symptoms for traumatic mutism is that one of the main symptoms is a sudden loss of speech following the traumatic event. So the person may become emotionally distressed, anxious, or withdrawn. So they may also avoid social interaction and communicate only through gesture, facial expression, or writing. Some individuals may also show signs of fear, sadness, or emotional instability. So let's move on to the third mutism, which is total mutism. So the causes of total mutism may be caused by severe psychological conditions, serious neurological disorders, or developmental disabilities. In some cases, the cause may be related to significant damage to areas of the brain responsible for communication. It is generally considered one of the more severe forms of mutism because the person does not speak in any situation. So for the symptoms of total mutism, the primary symptom is a complete absence of speech, unlike selective mutism, where speech occurs in some environments. Individuals with total mutism remain silent in all situations. They may rely entirely on nonverbal communication methods such as gesture, sign language, pictures, or assistive communication device. So this condition can significantly affect social interaction, education, and daily life. So the last one, which is organic mutism, the causes of this mutism is caused by physical damage or abnormalities in the brain or nervous system. Common causes include strokes, traumatic brain injuries, brain tumors, infection affecting the brain, and neurological disease. So in this type of mutism, the problem is not primarily psychological, but rather a result of physical impairment affecting speech production. So the symptoms for individuals with organic mutism is that they may lose their ability to speak or have great difficulty producing words. They may also struggle to form sounds, pronounce words correctly, or express themselves verbally. Depending on the underlying condition, they may also experience other neurological symptoms such as muscle weakness, poor coordination, memory problems, or difficulty understanding language. To conclude everything, the four types of mutism differ in their causes and symptoms. I will recap everything back, which is the selective mutism is mainly caused by severe anxiety and affects speech in certain situations. Traumatic mutism occurs after a distressing or traumatic event. Total mutism involves a complete absence of speech in all situations. And lastly, organic mutism results from physical damage to the brain or nervous system. So understanding these different types of mutism is important because it helps professionals provide appropriate support, treatment, and communication strategies for affected individuals. So that's all from me. Thank you for listening.